The hospital lights died for 3 seconds, and when they came back, 41 people were already dying on the floor. Nobody called for the senior staff. They called for the woman mopping up a supply spill in Bay 4. Kara Whitfield, 36, night shift trauma nurse at Iron Gate Memorial Hospital in Duskwood, Montana, had spent 4 years being talked over, passed around, and quietly dismissed by the physicians who ran the floor. She never pushed back, never made noise. She showed up, did her work, and went home. To everyone at Iron Gate, she was competent, forgettable, and exactly where she was supposed to be. Below the chain of command and grateful for it. They were wrong about all of it. On the night of a severe winter storm that had locked down every highway in and out of Duskwood, the hospital received a mass casualty transfer. Survivors from a military logistics coordination event held 12 miles outside town. The guests had been exposed to something, no one knew what. The transfer paperwork was incomplete, the transporting medics were pale and shaking, and the attending physician on duty, Dr. Philip Hart, stood at the intake desk staring at the vitals readout like it was written in a foreign language. 41 patients, deteriorating fast, no toxicology specialist, no backup coming through the storm. Kara looked at the first patient's eyes, then the second, then the color of the third patient's fingernails. She already knew what she was looking at. She set down the supply cart, walked past Dr. Hart without a word, and started giving orders to the nursing staff. Nobody moved at first. Then the patient in bed 2 stopped breathing, and Kara's hands were already there. The symptoms were unmistakable to anyone who had seen them before. Progressive muscle failure, tightening of the chest wall, pupils blown wide and fixed, saliva pooling at the corners of the mouth. Not a standard overdose, not a cardiac event cluster. Something systemic, something deliberate. Kara had seen it once before, in a forward operating base outside Kandahar, when a supply line had been compromised and 3 soldiers went down within minutes of each other. She had been a U.S. Army combat medic then. She was 24 years old, and she had kept those 3 soldiers alive using field-stripped IV lines and a treatment protocol her commanding officer told her was unauthorized. They all survived. She was quietly reprimanded and quietly commended in the same week. She left the military 2 years later, carrying a discharge that said honorable, and a history she never volunteered to anyone. Now she was moving through Iron Gate's trauma bay with the same economy of motion she'd had in that FOB. No wasted steps, no second guessing, no performance of calm because she actually was calm. I need atropine. I need it now, and I need someone to get pharmacy on the phone because we're going to need more than what's in the crash carts, she said to the charge nurse, Donna Rael, who had 15 years on her and was staring at her like she'd grown a second head. You're a floor nurse, Donna said. I know what I am, Kara said. Get me the atropine. Donna got her the atropine. Kara moved through the bay methodically, triaging by severity, directing staff to stations, talking patients through their panic in a low, flat voice that somehow cut through the noise and settled people down. Doctor. Hart hovered at the edge of the room for 11 minutes before he started following her lead without being asked, because the numbers on the monitors were moving in the right direction, and he was smart enough to understand what that meant. By the time the second wave of transfers arrived, 9 more patients from the same event. Kara had a system running. She had also flagged 3 patients whose presentations were slightly different from the others. Delayed onset, secondary symptom clustering. She'd pulled those 3 aside and started a different protocol. When Dr. Hart questioned the deviation, she said simply, "These 3 were exposed longer. They're going to crash harder. I need you to trust me for 40 minutes." He didn't trust her, but he didn't stop her either. 38 minutes later, all 3 patients stabilized. Outside, through the locked automatic doors, a black government vehicle pulled into the ambulance bay. And the man who stepped out was wearing a uniform that didn't belong to any branch Iron Gate staff had ever dealt with directly. He scanned the room through the glass. When his eyes found Kara, he stopped walking. Colonel James Verath had led the federal investigation team dispatched from the Western Regional Defense Coordination Office the moment the incident at the logistics event had been flagged as a possible deliberate exposure. He'd been in the air for 90 minutes. He'd been briefed on the patient count, the hospital's resources, the staff on duty. Nobody had mentioned Kara Whitfield. He walked into the trauma bay and stood back, watching for 3 minutes before he spoke to anyone. What he saw stopped the questions he'd prepared on the flight. 50 patients, 47 of them stable, 2 in critical but holding, one in surgery for an unrelated pre-existing condition aggravated by the exposure. And at the center of it, a woman in standard-issue navy scrubs, hair pulled back, moving through the room like she owned the grid she was working in. He knew that movement. He'd trained with people who moved like that. Verath approached her quietly. "Who authorized the modified atropine protocol?" he asked. Kara didn't look up from the patient she was assessing. "I did." "On what basis?" "Prior experience with organophosphate exposure in a field setting." He paused. "What field setting?" She looked up then, looked at him directly. "The kind with sand and bad air, and no pharmacy." Verath stepped back. He made one call on his satellite phone. 30 seconds later, he ended it and looked at her differently. Because the name that had come back on the other end of that call, attached to a classified incident report from 11 years ago involving a compromised supply line, 3 soldiers, and an unauthorized treatment that saved all 3 lives, was Kara Whitfield. He'd read that report. Every investigator in his office had read that report because it had become a case study in field adaptive emergency medicine. He'd always assumed the medic in that report was dead or deployed somewhere he'd never intersect with. She was standing in front of him in a Montana hospital, wearing a name tag that listed her title as RN2. Verath turned to Dr. Hart, who had materialized at his shoulder. "Was this nurse given full clinical authority tonight?" Hart hesitated. She, took initiative. "Was she given authority?" Another hesitation. "No." Verath looked back at Kara, then at the room full of living patients. "She should have been," he said. Then his team moved through the doors behind him, and the nature of the night changed entirely, because this was no longer a medical emergency. It was a federal crime scene, and the exposure had not been accidental. The federal investigation moved fast once Verath's team had full access to the event site and the hospital's intake records. The chemical agent recovered from the ventilation system at the logistics event was a restricted compound, not commercially available, not something a civilian could source or deploy without institutional access. The working theory, confirmed within 72 hours, was that the exposure had been engineered by a contracted security firm hired to run the event, Bracton Miles Security Group, whose principal officer had financial ties to a defense contractor with a competing bid on the government contract. The logistics event had been organized to finalize. The motive was disruption. The method was poison. 50 people nearly died so one firm could eliminate a rival from a bidding process. What complicated the investigation, what nearly derailed it entirely, was the decision by Iron Gate Memorial's executive administration to get ahead of the story. Hospital CEO Warren Doss and Chief Medical Officer Dr. Sandra Pruitt had spent the hours after Verath's arrival not cooperating with investigators, but managing their exposure. They had reviewed the night's incident log and identified a liability problem. A floor nurse had operated far outside her sanctioned role, administered treatments without physician authorization, and directed clinical staff without proper authority. If any patient had died under her protocols, the hospital's insurance exposure would have been catastrophic. The fact that no patient had died apparently made no impression on either of them. Doss contacted the hospital's legal team before dawn. By 7 a.m., a formal complaint had been drafted against Kara, citing unauthorized clinical decision-making, breach of nursing scope of practice, and falsification of intake documentation, a charge so thin it was essentially accusatory decoration. At 9 a.m., Doss personally delivered the complaint to Verath's lead investigative liaison and suggested that the federal team might want to consider whether the nurse's rogue interventions had complicated the toxicological picture for investigators. Verath's liaison read the complaint, set it on the table, looked at Doss. 50 patients came in, she said. 47 stabilized within the first 2 hours. The 3 critical cases held. The mortality rate on an unmitigated organophosphate mass exposure at this scale is typically between 30 and 60%. Your nurse produced a 0% mortality rate with storm-compromised supply lines and no specialist backup. Doss said the protocols still mattered. "So does math," she said, and walked out. Verath reviewed the complaint himself that afternoon. Then he did something Doss hadn't anticipated. He forwarded it to the federal prosecutor already building the Bracton Miles case, flagged as potential evidence of institutional obstruction, because filing a formal disciplinary action against the primary responder in an active federal investigation, with the intent to discredit her testimony, was exactly the kind of move prosecutors like to put in front of juries. Within a week, Warren Doss and Sandra Pruitt were named as subjects of a secondary obstruction inquiry. Doss resigned before the formal notice arrived. Pruitt fought it for 3 weeks before her attorney advised her to stop. The disciplinary complaint against Kara was formally withdrawn, then formally expunged from the record. Bracton Miles Security Group's principal officer, Devin Hartwell, was indicted on 50 counts of attempted murder in the first degree, 1 count for each patient. His financial partner at the rival defense contractor, a man named Oswald Frey, was indicted as a co-conspirator. Both were denied bail pending trial. The trial lasted 19 days. Both men were convicted on all counts. Hartwell received 40 years without the possibility of parole. Frey received 22. The contracted security personnel who had physically deployed the agent, 3 individuals, received sentences ranging from 15 to 25 years. Kara was asked to give a victim impact statement at the sentencing hearing. She declined. "The patients can speak for themselves," she told Verath's liaison. "They already have." 6 months after the night of the storm, Iron Gate Memorial Hospital looked like a different institution, because in most of the ways that mattered, it was. The interim administration brought in after Doss and Pruitt's departures had spent the first 60 days conducting a full clinical culture audit, the results of which were uncomfortable enough that the hospital's board of directors authorized a complete restructuring of nursing authority protocols. Floor nurses in Iron Gate's emergency and trauma departments were granted expanded clinical decision-making rights in mass casualty and surge scenarios, a policy change that was written formally as a response to the events of November 14th. The policy document cited Kara Whitfield by name. She had not asked for that. She hadn't known about it until the interim CMO sent her a copy with a handwritten note that said simply, "This exists because of what you did. It will protect the next person who knows what you know." The 50 patients from the logistics event recovered. 46 of them made full recoveries. 3 sustained minor long-term effects from the exposure, 2 with intermittent respiratory sensitivity, 1 with a peripheral nerve issue in his left hand that responded well to ongoing therapy. All 3 had written to Kara personally. She had written back to all 3. Colonel Verath's office had quietly submitted a formal commendation request on her behalf to the Department of the Army within 2 weeks of the incident. The process took longer than anyone wanted. It always did. But 4 months later, the paperwork came through. The Army formally recognized Kara's actions during the classified Forward Operating Base incident 11 years earlier, upgrading the record from a redacted internal notation to a full commendation citation. Her service file, which had sat largely unremarkable in a federal archive, was updated to reflect what she had actually done. Verath flew to Duskwood to deliver the commendation in person. He didn't make a ceremony of it. He met her in the hospital's break room on her lunch hour, set the document on the table, and said, "This was always yours. The system just took a while to catch up." Kara looked at the document for a moment. Then she folded it carefully and put it in the front pocket of her scrubs. "Thank you," she said. "Is there anything you want?" he asked. "Formally, I mean. A transfer. A position. Something that fits your actual background." She considered it. He could see her considering it, not dismissing it, actually thinking it through. "I want to keep doing this," she said finally. "Here, this floor, these patients." He nodded like he'd expected that answer. "The Army could use someone like you," he said, "if you ever change your mind." "I know," she said. "That's not why I left." He didn't ask what she meant. He understood it well enough. The morning after Verath's visit, Kara returned to the same trauma bay where she'd spent the night of November 14th. Same floor, same equipment, same institutional smell of antiseptic and recycled air. There was a younger nurse on rotation, Petra Solis, 26, 8 months out of her clinical program, quick and good, and still figuring out how to carry herself under pressure. Kara had been watching her for weeks, the way she watched everyone, quietly cataloging what they were capable of. That morning, during a difficult resuscitation on a 60-year-old construction worker who'd come in after a workplace collapse, Petra had hesitated at the critical moment, not out of incompetence, but out of the particular paralysis that comes from not yet trusting your own read of a situation. Kara caught her eye from across the gurney. She didn't say anything. She just nodded once, a small, deliberate gesture that meant, "You already know. Do it." Petra did it. The patient stabilized. Afterward, in the hallway, Petra found Kara restocking a supply cart and said, "How did you know I had it?" Kara looked at her. "Because you hesitated instead of guessing. Guessing looks different. Hesitation means you know the answer and you're not trusting it yet." Petra was quiet for a moment. "Is that something you learned in the army?" Kara picked up a box of gloves and set it on the cart. "I learned it here," she said. "Same as you're learning it now." She pushed the cart down the hallway without looking back. No ceremony, no monument, no version of the story that required her to be something larger than what she already was. The corrupt men who had poisoned 50 people to protect a contract were in federal prison, their company dissolved, their assets seized. The administrators who had tried to bury her were gone from the institution they'd mismanaged. The patients who had survived the worst night of their lives were out in the world, living it. And Kara Whitfield was where she had always been, in the middle of everything, quiet and certain, waiting for whoever came through the doors next. She had never needed anyone to know her name. She had only ever needed to be there when it counted. That was enough. It had always been enough. And now, finally, the record agreed. Colonel James Verath didn't move from the spot where he'd stopped. He stood just inside the trauma bay entrance, satellite phone still in his hand, and watched Kara Whitfield cross the room to the patient in bed 11. A man in his mid-50s whose blood pressure had been dropping for the last 4 minutes in a way that would have looked unremarkable to most of the staff still managing the room, but had apparently not looked unremarkable to her because she was already there before the monitor alarmed. She didn't run. That was the thing Verath kept coming back to. Everything she did had a quality of contained urgency, fast enough that it mattered, controlled enough that it didn't spike the room's anxiety level. He'd seen that in maybe a dozen people over 23 years of federal and military work. It wasn't something you learned from a textbook. It was something you earned in situations where slowing down meant someone died. He pocketed his phone and moved to the edge of the room, staying out of the working space, watching. Donna Rael, the charge nurse, appeared at his shoulder without invitation. She was a solid woman in her late 40s, practical face, the kind of eyes that had seen enough to not be impressed easily. She'd been watching Verath watch Kara for the last few minutes, and her expression said she had opinions about it. "You going to tell me who you are?" Donna asked. "Colonel James Verath, Federal Investigation Unit out of the Western Regional Defense Coordination Office." "So, military?" "Federal. We work adjacent." Donna made a sound that wasn't quite agreement. "She's been doing this for 4 hours," she said, nodding toward Kara. "Without a break. Without anybody telling her to." "I know." "You know her?" Verath considered the question. "I know her file," he said. "Which isn't the same thing." Donna looked at him sideways. "Whatever's in that file, it's not the whole story." He didn't respond to that because she was right and he knew it, and confirming it felt like it would lead somewhere he wasn't ready to go yet. He watched Kara adjust the drip rate on the man in bed 11, say 2 words to the nurse assisting her, and move on to the next bed without pausing to register whether she'd done something exceptional. The man's blood pressure line stabilized 11 seconds later. Verath pulled out his notepad. The federal team arrived in full at 11:40 p.m. 6 investigators, 2 forensic technicians, and a hazmat specialist who went directly to the intake area to assess residual contamination risk. The trauma bay was formally designated a secondary evidence site, which meant the working arrangement Kara had built over the last 4 hours was now operating inside a law enforcement perimeter that nobody on the nursing staff had been briefed on. That created problems almost immediately. The hazmat specialist, a man named Greer, who communicated primarily through clipped declarative statements, decided that the IV lines running to patients in beds 3 through 7 needed to be documented before any further medication changes were made, which was a reasonable forensic position and a completely untenable clinical one because two of those patients were on time-sensitive infusion schedules that didn't care about evidentiary chain of custody. Kara found out about the hold when she went to adjust the line in bed 4, and the forensic technician standing beside it told her she needed to wait. She looked at the technician, then at the line, then at the patient. A woman in her late 30s whose color had been slowly improving over the last 90 minutes and would stop improving if the infusion rate wasn't corrected in the next few minutes. "I need to adjust this line," Kara said. "It's been flagged for documentation." "I understand that. I still need to adjust the line." "You'll need clearance from—" "Who do I talk to?" she asked. Not aggressive, not loud. The particular flatness of someone who had already calculated that this conversation was going to take longer than she had. The technician pointed toward Greer, who was across the room talking to one of Verat's investigators with his back to the bay. Kara walked over. She waited 3 seconds for a natural break in the conversation. When none came, she spoke into it anyway. "I have a patient in bed 4 whose infusion needs to be adjusted in the next few minutes. I need the hold on that line released." Greer turned. He was somewhere in his 50s, crew-cut silver hair, the look of a man who considered any deviation from protocol a personal insult. "We're in the middle of—" "I understand. The patient isn't." He studied her for a moment with the particular expression of someone deciding whether to be annoyed or condescending, and settled on something in between. "The lines in that section need to be documented in situ before any clinical changes are made. That's procedure." "Your procedure," she said. "I'm working under a different one." "Not in a federal evidence site, you're not. If that patient's potassium levels drop while I'm standing here having this conversation, she goes into cardiac arrest. You'll have an evidence site and a body." She kept her voice completely even. "Document the line now while I stand here watching, and then let me do my job." Greer opened his mouth. Verith, who had crossed the room quietly during the exchange, said, "Document it now, Greer." Greer closed his mouth. He looked at Verith with the expression of a man noting an objection for the record, then nodded to the technician across the room. Kara was already walking back to bed 4 before the nod completed. Verith watched her go. Then he looked at Greer. "Move the documentation hold to lines that aren't on active adjustment schedules. Work with the charge nurse to identify which ones." Greer looked like he had significant feelings about this. "That's going to compromise. It's going to compromise less than the alternative," Verith said, and went back to his notepad. By 1 a.m., the patient count had stabilized at 52. 2 additional transfers had arrived after midnight. A man and a teenage boy, both from the outer perimeter of the event site, both presenting with delayed onset symptoms consistent with lower-level exposure. Kara flagged them as secondary exposure cases and started them on a modified protocol. Lower initial dosage, extended observation window, different symptom threshold for escalation. Dr. Hart, who had found his footing somewhere in the last 2 hours and was now functioning as a genuine clinical partner rather than a bewildered bystander, reviewed her protocol notes and added 2 adjustments she'd missed. She accepted both without argument, made the changes, moved on. That was the version of the night nobody outside the trauma bay would see. The one where she'd been wrong about 2 things, and somebody else had caught them. Not dramatically wrong, not life-threateningly wrong, but wrong in the quiet, specific way that medicine was full of, where the difference between one judgment call and another was sometimes a question of who'd had more sleep or whose hands were steadier at 1 in the morning. She'd been awake for 19 hours. Her hands were not entirely steady. She'd noticed that somewhere around midnight and started compensating, taking an extra second on anything that required fine motor precision, double-checking her own reads before acting on them. It wasn't a system she'd ever read about in a nursing manual. It was something she'd worked out in a field hospital at 3 a.m., with a headlamp and no backup and a soldier bleeding through a wound pack. The memory surfaced and she pushed it back down. There was no useful reason to be in Kandahar right now. She was in Duskwood, Montana, and the teenager in the new intake bed was frightened in the particular way that teenage boys were frightened when they didn't want anyone to know they were frightened. Jaw tight, breathing controlled, eyes moving around the room and snapping back to the ceiling whenever anyone looked at him. "What's your name?" she asked, pulling on a fresh pair of gloves. "Marcus," he said. Then, like he'd been raised with manners, even under duress, Marcus yelled. How old are you, Marcus? 17. Were you at the event with family? A pause. My dad. He works logistics for the government. He brought me because he stopped, swallowed. Is he here? Kara checked the intake list. There was no yelled on it. I don't see a record under that name. That doesn't mean he's not here. It means I need to check with the team managing the intake records. She kept her voice level, not soft, not clinical, the register she used when she needed to be believed. Right now I need to focus on you. We'll find him. Marcus looked at the ceiling. His jaw worked. He didn't look good, he said. When they put me in the van, he was on the ground and they told me he was being treated and I should go, but he didn't look. Marcus. She waited until he looked at her. I will personally find out what I know about your father and I will tell you. No spin. What I find out is what I'll tell you. He studied her face for a moment with the sharpness that teenagers had when they were deciding whether an adult was worth trusting. Okay, he said. She finished her assessment and flagged Donna to check the intake records against a first name of Yeld, the man from the event, possible critical case, family member present. Then she moved to the next patient and kept moving, because the room didn't stop because one conversation needed a moment to breathe. She found out 40 minutes later when Donna caught up with her in the supply corridor. There's a Gerald Yeld, Donna said. He came in with the first transfer. Kara, he's in surgery. What for? Cardiac event secondary to the exposure. He went into arrest on the transfer vehicle. They got him back, but... Donna pressed her lips together. He's not good. Kara was quiet for a moment. How old is he? 49. She thought about the boy in the intake bed, the tight jaw, and the ceiling staring, and the way he'd said he didn't look good, like he already knew what that meant and was hoping someone would tell him he was wrong. Keep me updated on his status, she said. The second anything changes. Donna nodded. Kara went back out into the bay. It was somewhere around 2:15 a.m. when Verath's lead investigative liaison, a woman named Agent Rourke, first name never offered, possibly not in use, found Kara in the small medication prep area off the main bay and told her that she was needed for a formal interview. When? Kara asked, drawing up a syringe with the focused inattention of someone doing something automatic. Now would be preferable. I have 42 patients. I understand that. This won't take long. Kara set the syringe in the labeled tray, looked at Rourke directly for the first time in the conversation. The agent was younger than she'd expected. Late 30s, sharp-faced, dark hair pulled back in the efficient style of someone who'd stopped caring about hair somewhere around year 3 of federal work. She had the posture of someone who was used to people cooperating with her and was already calculating how to handle it if Kara didn't. Give me 10 minutes to hand off to Dr. Hart, Kara said. Of course. The interview room was actually the hospital's family consultation space, a beige room with chairs that had been chosen for their capacity to feel neutral and had succeeded too well. Rourke sat across from her with a tablet and a legal pad, which Kara found interesting. Investigators who trusted their technology used just the tablet. The legal pad meant she was expecting something that might not translate cleanly to a digital record. The first 20 minutes were straightforward. Timeline, patient presentations, treatment decisions, clinical rationale. Kara answered everything directly and completely, including the 2 instances where she'd made adjustments to standard protocol and the reasoning behind each one. She didn't soften anything or add context that hadn't been asked for. Then Rourke asked, "Where did you encounter organophosphate exposure in a field setting?" Kara had been expecting the question since the beginning of the interview. It had just taken a while to arrive. "During my service with the Army," she said. "What unit?" "I'd rather not discuss the specific unit." Rourke's pen stopped moving. "You'd rather not." "The operational context is classified. You can verify my service record. What I did tonight was based on that training. I'm not disputing that. But the specifics of where and how I encountered it aren't something I can go into in a civilian interview." Rourke looked at her with the careful neutrality of someone reassessing a situation. "Colonel Verath has already flagged your file." "I know." Then you know we have access to. You have access to what the Army has cleared for interdepartmental sharing, Kara said. That's not the same as everything. A pause. The kind that had weight in it. Ms. Whitfield, Rourke said, and there was a different quality in her voice now. Not harder, exactly, but more deliberate. I want to be straightforward with you. The exposure tonight was not accidental. We're treating this as a deliberate attack. The people who were poisoned tonight were targeted. And the fact that 52 of them are currently alive instead of a different number is substantially attributable to your actions. Kara didn't say anything. That means you're a material witness in a federal investigation into an act of mass-targeted poisoning, which means your background, your training, your knowledge of this specific agent, all of it is relevant to the case we're building. I understand that. So when you tell me you'd rather not discuss certain details, I'll tell you everything that's relevant to what happened in that room tonight, Kara said. I'll tell you what I recognized, what I did, why I did it, and what the outcomes were. I'll tell you that I've seen this agent before, and I knew the treatment protocol because I had to use a version of it in a field context that I can't discuss in detail. She kept her voice level. Not defiant, just clear. What I won't do is hand you a roadmap to a classified operation because it's inconvenient not to. If you need that information, go through the Army. They know where the doors are. Rourke studied her for a long moment. Then she wrote something on the legal pad, and from where Kara was sitting, she couldn't read what it was. All right, Rourke said. Let's talk about the administrative decisions you made in the trauma bay, starting with the pharmacy authorization. The interview lasted 2 hours and 17 minutes. When Kara came out of the consultation room, the sky through the hospital's east-facing windows was the particular blue-gray of 4:30 a.m., the color that didn't belong to night or morning. She stood in the corridor for a moment with her back against the wall and her eyes closed. Her feet hurt. That was the most immediate thing. The specific bone-deep ache of 12 hours on a trauma floor, the kind that set up in the arches first, and then migrated to the lower back and stayed there. She'd had worse. She'd had shifts in the Army where she'd been on her feet for 32 hours, and then been told to get 2 hours of sleep and report back. But that had been a different body, or at least a body that had been younger, and had made different calculations about what it could absorb. She opened her eyes. Down the corridor, through the bay entrance, she could see Donna Rael standing at the central station, talking to one of Verath's investigators in the careful tone of someone being cooperative while also being precise about the limits of their cooperation. Good. Donna had good instincts about that kind of conversation. Kara pushed off the wall and walked back into the bay. The shift had changed while she was in the interview. Day team starting to filter in, the room's energy beginning its slow rotation from the focused depletion of an overnight emergency to the slightly more organized chaos of a morning clinical floor. 2 of the day nurses glanced at her when she came in with the particular look that meant they'd been briefed about the night, but were still calibrating what they'd actually walked into. She went to check on the patient in bed 4 first. The woman was awake. Her eyes tracked when Kara came in, and after a moment she said, "You were here before, earlier." "Yes," Kara said. She checked the monitor reading, scanned the chart. "How are you feeling?" "Terrible." A pause. "Better than I was." "That's accurate." "Are the others—" The woman stopped, reorganized the question. "People I was with at the event. Are they, Most people are doing what you're doing," Kara said, "getting through it." The woman looked at her for a moment. She was somewhere in her 60s, had the look of someone who was normally put together and was acutely aware of what the IV lines and the hospital gown were communicating about her current state. "What happened to us?" Kara thought about how to answer that. The investigation was active. There were things she didn't know, and things she wasn't cleared to confirm. "Something made you sick," she said. "People are working on the why. Right now the focus is on making sure you keep getting better." It wasn't a satisfying answer. The woman's expression said she knew it. But she nodded anyway, because she was also exhausted, and the more demanding questions could probably wait until she'd slept. "Thank you," she said, "for—" She gestured vaguely at the room, at everything. "Rest," Kara said. "That's the job right now." She moved on to the next bed. She was checking the chart on the man in bed 7 when Donna appeared at her shoulder with the look that had specific information behind it. Gerald yelled, "Is out of surgery," Donna said quietly. Kara kept her eyes on the chart. And? He's alive. They're calling it. It's going to be a long recovery. There's some heart damage, but he made it through the surgery. Kara set the chart down, exhaled once through her nose, controlled. Marcus is still in bed 14, Donna said. He's been asking. I'll go. She crossed the bay toward bed 14. The teenager was lying on his back with his eyes open, staring at the ceiling. The same position he'd been in when she last checked on him, though the quality of the stillness was different now, more brittle. The kind of stillness that was actually the absence of movement, because movement might crack something open. She pulled the curtain and stepped in. He looked at her immediately. Your father made it through surgery, she said. He's in recovery. There's going to be a longer road ahead of him, and I'm not going to pretend otherwise. But he's alive. Marcus pressed his lips together, nodded twice, quick. His eyes were too bright. Can I see him? Not yet. A few hours, probably. Once they have him settled. He nodded again, looked back at the ceiling. After a moment, You said you'd tell me what you found out. I did. You didn't make it sound better than it was. No. A pause. My dad always says people do that. Make things sound okay when they're not, so you don't worry. He swallowed. He hates that. So do I, Kara said. She stayed another minute, which was longer than she could strictly afford, but was what the situation required. Then she told him a nurse would check on him in 30 minutes and left him with the ceiling and whatever he was working through. She was halfway back to the central station when one of Verath's investigators intercepted her, a younger man, mid-30s, carrying a tablet he clearly wanted her to look at. Ms. Whitfield, I'm Agent Dario Cast. I need you to look at something. She stopped. What is it? He turned the tablet toward her. It showed a photograph. Security camera footage, stilled on a single frame. A man in a service uniform, the contracted security personnel who'd been running the event site, standing near what appeared to be a ventilation access panel. Do you recognize this person? She looked at the image. No? This was taken at the event venue at 7:43 p.m. The exposure began at approximately 8:15. We believe this individual accessed the ventilation system. We're trying to establish a full picture of the operational chain, who directed this, who executed it, and who had knowledge of it in advance. Why are you showing this to me? Cass glanced toward Verath's position across the room, then back at her. Because the individual in this photograph used a chemical agent that requires specialized knowledge to deploy effectively. Our forensic team has identified the compound. Colonel Verath is familiar with it from a prior investigation. He paused. And because your recognition of it tonight, the speed of it, the specificity of your treatment decisions, suggests you have knowledge of this compound that goes beyond general clinical training. Kara looked at him. I already had this conversation with Agent Rourke. I know, she briefed me. He lowered the tablet. Ms. Whitfield, I'm not trying to pressure you, but this investigation is moving fast, and there are people who had access to this compound who are currently unaccounted for. If you have any information about the source, the network, anything, it could matter. I don't, she said. I know the agent. I don't know where they got it, and I don't know who directed the attack. He nodded. Started to say something else. Then his radio crackled. A voice on the other end, clipped and urgent. Cast, we need you at the secondary site. Now. We found something. Cast's expression shifted. He looked at Kara once more like he was going to leave her with something and hadn't decided what yet. Then he moved toward the exit, fast. Kara watched him go. Around her, the normal machinery of the hospital morning was reasserting itself. The shift change noise, the distant sound of a supply cart in the hallway, the particular frequency of monitors in rest versus monitors alarming. Familiar. Grounding. But something had changed in the room's atmosphere in the last 30 seconds. She could feel it the way she could feel a drop in barometric pressure before a storm. Not a thing she could point to and name, but a thing she trusted because it had been right before. She looked toward the trauma bay entrance. Two of Verath's investigators who had been stationed near the door were gone. She looked toward the central station. Donna was on the phone. and her face had the specific stillness of someone receiving news they were trying not to react to. Kara crossed to the station. Donna looked up and covered the receiver. "What is it?" Kara asked. Donna's voice was low. "There's a second site," she said. "Another exposure. Different location, about 4 miles from the event venue." She paused. "They're saying it might be bigger than tonight." Kara went very still. "How many patients?" she asked. Donna uncovered the receiver and asked the question, listened, looked at Kara. "They don't know yet," she said. "They're still counting." And in that moment, through the trauma bay's east-facing windows, the first ambulance lights appeared on the road, red and white cutting through the pre-dawn dark, coming fast, not slowing down. Then a second set of lights behind it. Then a third. The fourth set of lights appeared before the third one had fully cleared the on-ramp. Kara counted them through the east-facing windows without moving from the central station. 4 ambulances, staggered by maybe 90 seconds each, coming in from the direction of Route 7, where it bent around the Harwick Industrial Corridor before straightening out toward Duskwood proper. Not the direction of the event venue. A different origin point entirely. She turned to Donna. "Get Dr. Hart out of wherever he is. Tell him we have incoming unknown count. Same presentation as tonight." Donna was already moving. Kara went to the trauma bay entrance and pushed through to the ambulance bay just as the first vehicle was backing in. The overnight air hit her, cold, clean, the particular bite of Montana at 5 in the morning. And she used it, let it cut through the fatigue for a few seconds before the back doors of the first ambulance opened and the world got loud again. 2 paramedics, a woman and a man, both of them moving with the compressed urgency of people who'd already been running for too long. The patient on the gurney between them was a man in his 40s, heavy-set, wearing what had once been a dress shirt. He was conscious, but barely. Eyes half open, jaw slack, the shallow chest rise of compromised respiration. "Same as your other patients?" Kara asked the female paramedic directly. "We don't know what your other patients have," the paramedic said, not unkindly, just efficiently. "We've got a secondary event site. Warehouse District off Harwick Road. Someone called it in as a mass casualty about 40 minutes ago. We've been pulling people out for 20. How many total?" "At least 30. We've got 3 more units behind us." "What's the venue?" "Looks like a secondary event space, private dinner, same contractor as the other location, we're being told." Kara stepped back to let them wheel the gurney through and was already calculating. 30 additional patients minimum, current bay capacity stretched to its operational edge, nursing staff mid-shift transition, medication supply depleted from the night's run. The atropine situation was the most immediate problem. She'd flagged low inventory twice in the last 2 hours, and the pharmacy's overnight supply had been pulled down hard. If 30 patients came in with the same presentation as the first wave, they were going to hit a wall somewhere around patient 15. She caught the arm of a third paramedic coming out of the second ambulance. "Who's running the secondary site?" "Federal team just took over. There's a Colonel Verath?" "Yeah, he's out there now." She let the paramedic go and pulled out her hospital radio. Found the frequency for pharmacy. "This is Whitfield in trauma. I need an emergency inventory check on atropine, pralidoxime, and diazepam. Right now. And I need to know if we can get an emergency supply transfer from Ridgecrest Community or the Bitterroot Clinic before 6 a.m. The pharmacist on the other end, a careful, methodical man named Osei, who Kara had a genuine working respect for, said he'd have numbers in 4 minutes. She told him she needed them in 2. She went back inside. Hart was at the central station when she got there, still buttoning his coat, his hair imperfectly arranged in the way of someone who'd been resting in a supply closet because there was nowhere else to go. He looked at the incoming gurneys with the expression of a man adding a column of numbers and not liking the sum. "Secondary site," he said. "Harwick Road. Same agent, preliminary. We're going to get at least 30 more." He rubbed the back of his neck. We don't have the capacity to not take them," she said. "Ridgecrest is 40 minutes in good conditions, and it's not good conditions. We're what's available." He knew that. She could see him knowing it, working through the same arithmetic she had. "What do you need?" "I need you to work the critical cases and let me manage the floor. Same as tonight." A beat. Not a long one. Same as tonight, he said. That was enough. She pulled the incoming nursing team into a fast 3-minute brief at the station. No framing, no explanation of the larger situation, just the clinical facts. Incoming patient count, expected presentation, treatment protocol, supply limitations. 2 of the day nurses had been briefed about the night by the outgoing staff and had expressions of people who understood they'd arrived into something larger than a normal shift. The third was a traveling nurse named Bautista, who'd been at Iron Gate for 6 weeks and had the particular adaptability of someone accustomed to walking into unfamiliar situations. He asked 2 precise questions about the modified atropine protocol, got his answers, and moved to his station without needing anything else from her. Osei called back in 3 minutes and 14 seconds, which Kara chose not to comment on. The numbers were worse than she'd hoped and better than she'd feared. Enough atropine for approximately 22 patients at standard dosing, which could be stretched to 28 if she ran modified protocols on the lower acuity cases. Pralidoxime was the actual problem. They had enough for 12 patients, period. After that, they were managing symptoms without the reactivation component, which changed the outcome calculus significantly for anyone with high-level exposure. Emergency transfer from Ridgecrest, she asked. They can get us pralidoxime, but their overnight driver is out and they'd need to call in. How long? 90 minutes minimum. 90 minutes. She did the math against the incoming patient timeline. The first wave from the secondary site would hit peak treatment demand in about 45 minutes. The supply gap was going to open exactly when it was least useful to have it open. Tell them to start the process now, she said, and call Bitterroot. See if they have any in emergency stock. She hung up and turned around to find Varath standing 3 feet behind her. She hadn't heard him come in, which bothered her more than she let show. You know about the supply issue, she said. It wasn't a question. My team is sourcing from the Federal Emergency Medical Cache. There's a depot in Missoula. We're looking at 60 to 70 minutes for transport. I need it in 45. I know. He held her gaze. I'm telling you what's real. She accepted that, because there was nothing else to do with it. What's the count at the secondary site? Confirmed 31. We think there may be more. The venue had a back section that wasn't evacuated cleanly. My team is still doing a sweep. Same agent? Almost certainly. Same deployment method, ventilation system, timer triggered. This wasn't opportunistic. Someone planned 2 simultaneous exposure events at 2 different locations attended by overlapping populations of federal contractors and government logistics personnel. She looked at him. They knew the hospital would be split. He didn't answer immediately, which was its own kind of answer. We're working that hypothesis. Meaning they also knew the supply situation. They knew 1 hospital, 1 overnight staff, limited specialty resources. She felt the shape of it settling into something ugly and deliberate. They designed the medical response into the attack. Varath's expression didn't change. I said we're working the hypothesis. That's a yes. That's a we're working it, he said firmly. Don't get ahead of the evidence, Ms. Whitfield. Treat the patients in front of you. It was, she recognized, the same thing she'd said to younger medics in the field when they started thinking about the size of the problem instead of the piece of it in their hands. She took it without resentment. I need your team to stay out of the active treatment area, except for the designated interview positions we set up earlier, she said. We're about to double our patient count, and I can't have extra bodies in the working space. Understood. And I need someone from your team with authority to expedite the Missoula transfer. 60 minutes isn't acceptable. I'll put Rourke on it. He moved away. She moved toward the incoming gurney from Ambulance 3. The next 40 minutes were the kind that didn't have narrative shape while they were happening. Just a continuous present tense of assessment and decision and movement, one patient giving way to the next without any sense of completion, because completion wasn't the metric. The metric was the monitors. The metric was the respiratory rate. The metric was whether the person in front of her was getting worse or getting better, and most of them, for the first while, were getting worse before they got better because that was the nature of the exposure curve. The secondary site patients were, on average, in rougher condition than the first wave. More concentrated exposure, Kara guessed, smaller space, less ventilation, longer dwell time before anyone understood what was happening. Several had clearly attempted to leave the venue and collapsed in the parking area outside, which had delayed their discovery and extended their exposure window. She worked through them methodically, made calls she was confident in, made 2 calls she was only 60% confident in, and documented both in real time because 60% was what she had and the alternative was nothing. One of those calls paid off in the right direction within 20 minutes. The other one, a decision to delay escalating a patient named Harold Tufts to critical status because his presentation didn't quite fit the pattern, turned out to be wrong, and she caught it herself when she circled back and found his oxygen saturation had dropped 4 points in 12 minutes. She said something under her breath that she would not have said in front of Marcus Yeld and moved Tufts to critical and adjusted his protocol, and the number she'd said under her breath remained accurate in retrospect, but the situation was recoverable, and she recovered it. Hart caught it too, from across the room, and gave her a look that wasn't critical so much as noting. She returned it with one that said she knew. That was the entire conversation. Around the 30-minute mark, with 23 secondary patients processed and 8 more incoming from the final 2 ambulances, the pralidoxime supply hit its limit. She'd expected it. She'd been managing toward it, rationing the reactivation agent to the highest acuity cases, running lower-level presentations on atropine alone with aggressive symptomatic management and tighter monitoring intervals. It was the right call, and it was also an uncomfortable one, because the patients who didn't get pralidoxime were more likely to have prolonged recovery timelines and some degree of residual nerve effects. The clinical literature on that was uneven. She knew what she was doing, and she also knew what she was accepting, and those 2 things didn't sit cleanly next to each other. The federal supply from Missoula hadn't arrived. She grabbed her radio, found Rourke's channel. "Where's the Missoula transfer?" Rourke's voice came back with a layer of background noise. She was still at the secondary site, Kara realized. "Vehicle is en route. ETA revised to 52 minutes. I needed it 40 minutes ago." "I'm aware of that. The driver's situation. I don't need the explanation. I need the medication." A pause. "It's coming as fast as it can, Ms. Whitfield." She clipped the radio back and went to the next patient. The next patient was a woman named Dolores Faber, 63, retired federal procurement officer, and she was one of the ones Kara couldn't help watching. Not because her case was the most critical, it wasn't, but because she was fully conscious throughout, oriented and coherent, and that meant she understood what was happening to her body in a way that the less conscious patients didn't have to. There was a particular courage in that. Faber had asked twice for updates on her husband, who'd been at the same event. Donna had confirmed he was in the system and being treated, which was the most accurate thing she could say because it was all she knew. Kara told her that directly when Faber asked a 3rd time. "He's in the system. He's being treated. I don't have more than that." Faber looked at her with steady eyes. "Is that a good sign or a bad sign?" "It means I don't have information to give you yet. When I do, I will." Faber thought about that. "You don't sugarcoat things." "No?" "Good," Faber said, and closed her eyes in the way of someone conserving energy for something that mattered. Kara checked her line and moved on. At 5:47 a.m., the situation changed shape for the 2nd time that night. Verath found her at the medication prep station, and his face was doing something she hadn't seen it do in the hours she'd been working around him. A kind of contained effort, the look of someone holding a thing steady, that wanted to move. "We need to talk," he said. "I'm in the middle of... Now, 30 seconds. She set down what she was doing, turned to face him fully. "The sweep at the secondary site turned up 2 additional victims in the back section," he said. "Non-civilian." She waited. "Federal investigators. Part of the team that was dispatched to the logistics event earlier this evening. They were conducting a preliminary site assessment at the Harwick venue when the exposure occurred." She understood immediately why he was telling her. "What's their status?" "One is stable, one is critical. They're in the last ambulance. ETA, 4 minutes. The critical case had approximately 90 minutes of unprotected exposure before extraction." He kept his voice entirely level. "I need to know if your team can manage that." 90 minutes of unprotected exposure to the agent she'd been treating all night. For the lower acuity patients with 20-minute exposures, the clinical course had been serious but manageable. For someone who'd been in it for 90 minutes without intervention. "I need the Missoula supply here when that ambulance arrives," she said. "Not in 50 minutes. Now." "I've already made the call. The vehicle is being expedited, but I can't guarantee." "Then I'll work with what I have." She pulled off her gloves, pulled on fresh ones, and moved toward the bay entrance. Which one is critical? A fractional pause. The critical case is Agent Cast. She stopped walking for exactly 1 second. Dario Cast, who had shown her the security footage 2 hours ago, who had been called to the secondary site, who had gone into a building that was already contaminated without knowing it was contaminated, and had been in it for an hour and a half doing his job. She started walking again. I need your team entirely out of the treatment area for the next 20 minutes, she said over her shoulder. All of them. Verith, I mean it. Done, he said. The ambulance was backing in as she hit the bay doors. Cast was in worse shape than she'd expected, and she'd expected bad. His pupils were pinpoint and fixed, his secretions already heavy. She could hear the wet labor of his breathing from 3 feet away. His skin had the gray-green quality that she associated with prolonged cholinergic crisis. The body's systems flooded and misfiring, the acetylcholine buildup affecting everything simultaneously: heart rate, respiration, glandular function, muscle control. Both arms were showing fasciculations, the small, involuntary muscle twitches that indicated the nerve agent was working systemically. He was not conscious. She took the gurney directly to the one bay space she'd held open, the most monitored position closest to the crash cart, and started talking to her team before she'd fully stopped moving. I need atropine 2 milligrams IV push right now, and I need someone timing from first dose. Suction setup? I can hear the secretions from here. Oxygen at 15 liters, and I need whatever pralidoxime we have left drawn up and ready. We have enough for 1 full dose, Bautista said, already moving. 1 full dose. For a patient who needed it more than anyone else in the room. She felt the math of that in her chest and pushed past it. Then we use it here. The next 15 minutes were not clean. They were not a demonstration of anything except the hard physical reality of trying to hold a body together when a chemical compound is working systematically to take it apart. Cast went into respiratory distress 4 minutes in, and she managed it manually for 40 seconds while Bautista got the equipment positioned, which was 40 seconds longer than she would have liked, and produced a bruise on her left hand from the mask pressure that she wouldn't notice until tomorrow. His heart rate spiked, and then dropped, and she called the drug adjustment before the monitor alarmed because she could see it coming in the waveform, and Hart, who had materialized on the other side of the gurney, confirmed the call before she'd finished giving it. That was the closest thing to smooth in the whole 15 minutes. The rest of it was reactive, physical, and twice actually frightening. Not in the way that fear usually presented for Kara, which was a cold clarity that sharpened her perception, but in the rawer, simpler way of watching a person's body fail at multiple systems simultaneously and having a finite number of responses to deploy against an infinite number of possible trajectories. She deployed them. Some worked partially. One didn't work, and she pivoted in 6 seconds and tried something else. Cast's respiratory rate stabilized at minute 16. Not good, but stable. His pupils remained unresponsive, but his heart rate had found a rhythm she could work with. The fasciculations were decreasing. She stepped back for exactly 10 seconds, looked at the monitor, looked at his face, did the assessment in her head the way she'd been trained to do it, not how she felt about the situation, but what the situation actually was. He was alive. He was critical. He was going to stay that way for a while. Continuous monitoring, she said. I want someone with eyes on this bed for the next hour. Any change in respiratory rate, any drop in SAT below 90, you call me immediately. I don't care where I am. She pulled her gloves off. Her hands were shaking slightly. Not much. The kind of tremor that comes from sustained fine motor work under sustained stress, and she put them in her pockets where nobody would see it. Verith was at the edge of the treatment area, exactly where she'd told him to be. He'd watched the last 15 minutes in the stillness of someone who understood what he was looking at. She crossed to him. He's alive, she said. That's all I can give you right now. Verith nodded. There was something in his face that she recognized as the particular grief of someone responsible for the people under his command. Thank you, he said, in a voice stripped of its usual authority, just a person saying a plain thing. She accepted it without comment. The Missoula vehicle arrived 9 minutes later, 22 minutes ahead of the revised ETA, which meant someone had made a serious phone call to make that happen. The pralidoxime went directly to the 3 remaining critical patients who hadn't received it, and Kara adjusted Cass's protocol to include a second dose once his system had processed the first. By 6:30 a.m., the count was stable. 79 patients total between the 2 sites. 64 stable. 11 critical. 4 severe but improving. No deaths, a number that Kara knew was not a given and did not let herself treat as one. She was standing at the central station updating the chart summary when Agent Rourke appeared beside her with the particular directness of someone who had been waiting for a moment that wasn't coming and had decided to create one. "Ms. Whitfield, I need to debrief you on the secondary response." "I know. I also need to inform you that our investigation has produced information that directly implicates a member of Iron Gate's administrative staff in the planning of this attack." Kara set down the chart. "Which member?" she asked. Rourke's jaw was tight. "We'll go over the full picture in the interview room." "Tell me which member." A pause, the kind that had the answer already in it. "Warren Doss," Rourke said, "the hospital CEO. We believe he had advanced knowledge of both events, and we have evidence that he attempted to access and alter the hospital's chemical inventory records at 3:18 this morning while you were treating the first wave of patients." The sound of the trauma bay continued around them. Monitors, voices, the soft percussion of a hospital in motion. Kara stood very still in the middle of it. "He was in the building," she said. "He was in his office," Rourke said. "He's been in his office since 2 a.m. Kara looked toward the administrative corridor at the far end of the hospital, where the executive offices were, where they had always been, 1 floor above and a building length away from the people on the floor below them, who were currently fighting to keep 79 poisoned patients breathing. "Is he in custody?" she asked. "We're moving on that now." Rourke looked at her steadily. "I wanted you to know before you heard it another way." Kara picked up the chart again. "I need 10 more minutes," she said. "Then I'll come to the interview room." Rourke left. Kara finished the chart. She did it correctly, completely, the same way she had done every chart that night, because the documentation mattered, because the record mattered, because medicine was partly the thing you did in the room and partly the thing you wrote down after, and both halves had to be true. She handed it to Donna, looked once more at the trauma bay. The monitors, the patients, the nurses moving between stations, the specific organized chaos of a floor managing more than it was built for and managing it anyway. Bautista caught her eye from across the room, gave her a short nod toward Cast's bed. She looked. The monitor read stable. He was still critical, but the line was holding. She nodded back. She was halfway to the interview room corridor when her radio crackled, not the hospital frequency, but the secondary channel Verith's team had given her access to during the intake surge. It was Verith's voice, and it was very controlled in the way that things were very controlled when they were on the edge of not being controlled at all. "Ms. Whitfield, I need you to come to the administrative corridor, now." "I'm on my way to the administrative corridor," he said again. "We have a situation." She changed direction. The administrative corridor was on the building's north side. Institutional carpet, framed photographs of past board members lining the walls in the particular self-congratulatory arrangement of institutions that had been important to themselves for a long time. At the far end, outside the door marked CEO, Warren Doss, 2 of Verith's investigators were standing with the rigid positioning of people who had just discovered something they were waiting for authority to deal with. The door was open. Verith was inside. He was standing at the far side of the room, and he was looking at something on Doss's desk that she couldn't see from the doorway. When he heard her footsteps, he looked up, and his face told her before she'd crossed the threshold that whatever was in the room with him was going to change the shape of the next hour in ways she hadn't calculated yet. She walked in. On the desk, amid a scatter of papers and an open laptop showing a partially completed document, was a small industrial device, compact, cylindrical, approximately the dimensions of a large thermos. It had a digital timer display on its face. The display was not running, but it had a port on its side that matched precisely and unmistakably the deployment mechanism she'd seen diagrammed in a classified ordnance brief 11 years ago, in a briefing room in a forward operating base, before a mission she was never supposed to talk about. She looked at Verath. "That's not hospital equipment," she said. "No," he said. "How many?" He looked at her with the directness of someone who had run out of ways to soften what he was about to say. "We don't know yet. The sweep is ongoing." He paused. "But Doss's desk calendar has 4 locations marked for this week. We've addressed 2 of them. 2 down, 2 unknown, somewhere in or around Duskwood, Montana, in a hospital where 79 people were already fighting to breathe." "The hospital," she said. It wasn't a question. It landed like a stone in still water. Verath picked up his radio. Verath's radio call lasted 45 seconds. By the time he ended it, 2 of his investigators were already moving into the corridor, and the quality of movement in the administrative wing had shifted from the measured pace of active investigation to something faster and more deliberate. The specific gear change that happened when a search went from looking for evidence to looking for something that could still hurt people. Kara stayed in the doorway of Doss's office and looked at the device on the desk without touching it. The timer display was dark. That could mean it had already cycled through, or it could mean it hadn't been armed yet, or it could mean the battery had failed, and of those 3 possibilities, only one of them was acceptable. The casing was identical to what she'd seen in the ordnance brief. Same manufacturer, same port configuration. But the brief had been 11 years ago, and she was working from memory in a situation where working from memory had significant consequences if she was wrong. She was not going to touch it. Verath came to stand beside her. "Hazmat and EOD are 40 minutes out from Missoula. Same convoy as the medication transfer." 40 minutes. "There's a state police bomb unit in Billings. They're scrambling now. Best case, 65 minutes. She looked at the device, looked at the calendar on Doss's desk. A paper calendar, the old-fashioned kind, open to the current week. 2 locations circled in red marker, both with times written beside them. The first said Harwick/event, 8:15. The second said Harwick/secondary, 12 o'clock, delayed. Both times had a single diagonal line through them. The third circle said Irongate, HVAC, sublevel, 6 o'clock. She looked at her watch. It was 6:03 a.m. "Verath." He saw what she was seeing. "Get me a radio on the building frequency," she said. "And I need your team to start moving non-ambulatory patients away from the HVAC vents in the trauma bay. Do it quietly. Do not create a floor panic." He was already on the radio. She moved past him into the corridor. Bob. The hospital's sublevel was accessed through a utility stairwell behind the radiology wing, a door that required a facilities keycard, which Kara did not have. She had 11 years of not having it because floor nurses did not go to the sublevel and had no reason to. She stood in front of the door for approximately 3 seconds before she took her radio and called the facility's overnight manager, a man named Petrov, who had the phone manner of someone dragged into consciousness from a deep sleep, which he had been. "I need sublevel access," she said. "Right now." "Who is this?" "Kara Whitfield, trauma. I need someone with a keycard at the radiology stairwell in 2 minutes." "It's 6 in the morning. I don't know what you think." "There may be a device in your HVAC system," she said. "I need the door opened." A pause that was both too long and completely understandable. "A device." 2 minutes, Mr. Petrov." He made it in 90 seconds. She would remember that later, Zach. The fact that he ran, that he didn't ask more questions or stall for official authorization, that he showed up breathing hard and got the door open with hands that were shaking and did it anyway. Not everyone did the right thing under pressure. Petrov did. She went down. The sublevel was what building sublevels always were: concrete floor, industrial lighting on a motion sensor that came on in sections as she moved through it, pipe networks running along the ceiling in the dense parallel arrangements of a building's circulatory system. It smelled of machine oil and stale air, and the faint mineral trace of the Montana winter pushing through the foundation. The HVAC units were at the far end of the sublevel, through a secondary corridor that ran under the hospital's north wing. She moved through it quickly, not running. Running in the dark over an uneven floor toward a possible explosive device was not a rational choice, but not slowly either. She counted doors as she passed them, cross-referencing against the schematic she'd committed to memory on her first month at Irongate, when she'd walked every accessible part of the building because that was the kind of thing she did in a new place without really thinking about why. The HVAC room was the third door on the right past the water main junction. The door was closed but unlocked, which told her something. Either facilities hadn't been down here since last night, or someone had been here and hadn't bothered relocking because they didn't plan to come back. She pushed the door open and stood in the threshold. 4 HVAC units, large industrial models, bolted to a raised platform. Intake vents running from each unit into the ductwork above. Standard configuration for a building this size. And attached to the intake manifold of the second unit from the left, secured with 2 metal bands and a zip tie in the manner of someone who knew what they were doing but had worked quickly. Another device. Same dimensions, same port. The timer display was not dark. It read 0 hours, 14 minutes, and 22 seconds, and it was counting down. Kara stood in the doorway and felt the specific quality of stillness that she'd first encountered in a field hospital in Afghanistan, when a situation exceeded what the next 60 seconds could reasonably contain. She'd learned in that environment that the stillness wasn't calm. It was the mind stripping away everything that wasn't immediately useful and working with what remained. What remained? 14 minutes. An armed device she was not trained to disarm. EOD 65 minutes away. Verath's team upstairs dealing with patient evacuation. She got on the radio. Verath? I found the third device. It's armed. 14 minutes on the timer. I'm in the HVAC room, sublevel north. Verath's voice came back immediately. Get out of that room. I need someone who can tell me if there's a safe way to interrupt the deployment mechanism without triggering the release. The port on this unit matches the first device. Is there anyone on your team who... Whitfield, get out of that room and get upstairs. Is there anyone on your team? There's no one on my team who should be in that room right now. You are not EOD. Get out. She looked at the timer. 0 hours, 13 minutes, 41 seconds. The intake manifold on this unit feeds the trauma bay, the surgical suites, and the ICU, she said. If this releases the patients we spent the last 6 hours keeping alive, I understand that. I'm also telling you that you dying in that room doesn't save them. He was right. She knew he was right. She also knew that 13 minutes was not enough time for anyone with the right training to get here, and that the device in front of her was attached to a ventilation system that fed directly into a room with 79 poisoned patients and the nursing staff that had kept them breathing, and that the weight of that specific fact was not something she could put down easily. She went back up the stairs. The next 13 minutes were the most carefully managed chaos she had ever stood in the middle of. Verath had already started moving patients, quietly, which was the right call, because a floor-wide panic in a facility with 79 critical patients and a nursing staff at the edge of its operational capacity was its own kind of catastrophe. The day team nurses were repositioning patients away from the overhead vents using the cover of routine morning care, adjusting beds, rearranging monitoring equipment, offering explanations that were not lies but were not the complete truth either. Bautista was doing it with particular smoothness, talking to a patient about pillow positioning while methodically moving the entire bed 6 feet to the left. Hart found her at the central station. His face said he'd been briefed. What's the realistic outcome if it deploys, he asked. Depends on concentration in the ductwork and how long before anyone identifies what's happening. Best case, we catch it fast and treat it like we've been treating it all night. She paused. Worst case, we're treating staff and patients simultaneously with a depleted supply chain and no additional warning time. Hart absorbed that. What do we need to have ready? Every crash cart positioned and open, atropine drawn and ready to push. I want every nurse briefed on the trigger symptoms so the first person who sees it can start calling it without waiting for a doctor's order. That's outside protocol. So was everything I did last night. He held her gaze for a moment. Brief them, he said. She did it in 4 minutes, station by station, keeping her voice low and her words precise. No drama, no worst-case framing, just, here's what to look for, here's what to do when you see it, here's who to call. The nurses listened with the focused attention of people who understood they were being trusted with something real. Petra Solis, the young nurse from the night shift who'd stayed past her rotation because there was too much to hand off cleanly, was the last one Kara briefed. She was running on something past exhaustion at this point, the kind of elevated alertness that the body produced when it understood there was no alternative to continuing. She listened to everything, asked one question, a precise one about the threshold symptom between atropine appropriate and escalate to critical. Got her answer. Nodded. "What's the countdown at?" Petra asked. Kara checked her watch. "About 9 minutes." Petra looked at the overhead vent above the central station, then looked back at Kara. "Okay," she said, and moved to her position. At the 8-minute mark, Verath's team completed the sweep of the 4th calendar location, a community event center 3 blocks from the hospital, also owned by a Bracton Miles subsidiary, which had a device in its HVAC system identical to the others. Unlike Iron Gates, that timer hadn't started. They disabled it manually, following instructions from an EOD consultant patched in by phone from the Missoula depot, and the instructions worked, and the consultant's voice on the other end of that call was so calm it was almost eerie. Verath called Kara with that information at the 7-minute mark. She passed it to Hart without comment. The hospital's device reached 0 hours 6 minutes on its timer, and Kara was standing in the HVAC sublevel again. She'd gone back down because she couldn't make herself not go back down, and because she'd spent the time between her first visit and now thinking about the port configuration and the mechanism and the things she remembered from the ordnance brief that she hadn't been sure enough of the first time to act on. She was still not sure enough, but she was more sure than she'd been, and 6 minutes was different from 14. Verath's voice on her radio. "Whitfield, tell me you're not where I think you are." "The deployment port on these devices uses a standard pneumatic release mechanism," she said. "The brief I read in 2015 described a mechanical interrupt at the intake valve, a manual shutoff that would isolate the agent from the ductwork, even if the timer completed. I'm looking at the intake valve right now." Silence for 3 seconds. "That brief was for a 2014 generation device," Verath said. "This may not be the same generation. The port configuration is identical. The casing is identical." "That doesn't mean the internal mechanism is—" "I know," she said. "I know that." Another silence. 0 hours, 5 minutes, 12 seconds on the timer. "Describe the intake valve," he said. She described it. Heard him relay the description to someone on the other end, the EOD consultant probably. Waited. "There's a lever mechanism on the left side of the valve housing," the consultant's voice said, patched through Verath's radio with a layer of static over it. "It should be red. Rotating at 90 degrees clockwise will close the intake. That's the interrupt. It won't stop the device from completing its cycle, but it will isolate the release from the ductwork." "Should be," Kara said. "Should be," the consultant confirmed. 000433. She looked at the left side of the valve housing. There was a lever. It was red. She thought about the gap between should be and is, and what lived in that gap, and what the contents of the trauma bay above her head were worth against the contents of that gap. She put her hand on the lever. "I'm rotating it now," she said into the radio. "Whitfield," Verath's voice. She rotated it. The lever moved through 90 degrees with the firm resistance of a mechanism that hadn't been operated in a while but was not stuck, the particular physical feedback of a thing doing what it was designed to do. It completed the rotation and locked. Nothing happened. The timer read 0 hours, 4 minutes, and 1 second and was still counting. She watched it reach 0 hours, 3 minutes, 0 seconds. Then 0 hours, 2 minutes, 0 seconds. The intake valve lever stayed in its new position. The ductwork above her remained silent. At 0 hours, 0 minutes, 8 seconds, she took a breath and held it. At 0 hours, 0 minutes, 0 seconds, she heard a small, sealed hiss from inside the device casing. The pneumatic release cycling through, doing what it had been designed to do, pushing the compound into a manifold that now had a closed valve between it and everywhere the compound was supposed to go. And then nothing else. She stood very still for another 30 seconds, listening to the HVAC units running normally around her, the building breathing the way it was supposed to breathe. Then she got on the radio. The intake valve interrupt worked, she said. The device completed its cycle. The release was contained. Verath's response was not immediate, which told her he'd needed a second. Copy that, he said. Come upstairs. Now. She came upstairs. Sunday. Warren Doss was arrested at 6:41 a.m. in his office on the hospital's second floor by 2 federal investigators and a Montana State police officer who had arrived 12 minutes earlier. Kara was not present for the arrest. She was at the central station updating the critical patient charts when it happened, and she heard about it secondhand from Donna, who had heard it from a day shift orderly who'd been in the adjacent corridor. What Donna described, Doss in his office chair, looking not panicked, but strangely deflated, like something had gone out of him before the investigators even came through the door, matched what Kara would have guessed, which was that a man like Doss had probably understood by 5 a.m. that the shape of the morning was not going to improve for him. The arrest itself was quiet. That was the word the orderly had used. Quiet. No shouting, no attempt to negotiate or explain. Doss stood when asked to stand, put his hands where asked, and walked out of his own hospital through a side corridor with federal investigators on both sides of him, while the day shift moved around them in the ordinary business of a hospital morning. Kara thought about the calendar on his desk, the precise times, the methodical circled locations. Whatever Warren Doss was, he was not impulsive, which made the calculus of how someone like that arrived at poisoning government contractors even colder and more difficult to hold in the mind cleanly. She put it aside. There were 79 patients to manage. Sandra Pruitt, the chief medical officer, was arrested 20 minutes later, in the parking structure where she'd been sitting in her car since 5:30 a.m., with the engine running and her phone in her lap. Rourke told Kara that part later in the interview room, that Pruitt had apparently driven to the hospital, sat in the parking structure for over an hour, and not gone anywhere. Not driven away, not come inside. Just sat there. Waiting to see which way it went, Kara said. That's our read, Rourke said. What did she know? Rourke set a document on the table between them. Financial records recovered from Doss's laptop show payments to a holding account registered to Pruitt going back 14 months. We believe she knew the attack was being planned. We don't yet have evidence she knew the full scope. The timeline, the locations, the second site. Kara looked at the document. But she knew something was happening. We believe so. And she authorized the disciplinary complaint against me. At 7:02 a.m., yes, after the attack had already been executed. Rourke's voice stayed neutral, which Kara recognized as a deliberate choice. That complaint has been formally withdrawn and will not appear in any professional record. Kara looked at the wall behind Rourke for a moment. 14 months. Pruitt had been in the same weekly nursing leadership meetings with her for 14 months, signing off on staffing decisions and protocol updates and resource allocations, and somewhere underneath that had been carrying knowledge of a planned mass poisoning of government personnel. She signed off on our atropine reorder request 6 weeks ago, Kara said. I submitted an emergency restock request because we'd been running low. She approved it. Rourke went still. How much did that restock add to your inventory? Enough to treat approximately 20 additional patients above our standard threshold. Kara paused. Last night, that margin was the difference between having enough and running out before the Missoula transfer arrived. Rourke was already writing. She might not have known what she was approving, Kara said. The restock request was routine on paper, but if she did know, if she knew the attack was coming and approved a restock that helped treat the victims, that's going to be a complicated conversation for the prosecution, Rourke said, and a more complicated one for her defense. Kara didn't say anything to that. It was not her complication to resolve. The interview lasted 2 hours. She answered everything accurately and completely, including the sub-level incident, including the moment she'd put her hand on the valve lever with 4 minutes on the timer, including the fact that she had not been certain the interrupt would work and had done it anyway. She didn't soften that or explain it as more heroic than it was. She'd made a calculation. The calculation had been right. A different calculation might have also been right in a different direction. Rourke asked whether she'd understood the risk to herself. Yes, Kara said, and you did it anyway. There were 79 patients above my head. Rourke looked at her for a moment in the way of someone deciding whether to say something. Then she wrote it down instead and moved to the next question. By mid-morning, the character of Iron Gate Memorial had changed again. A third shift in less than 12 hours. This one visible even in the physical arrangement of the building. The federal presence was still significant but no longer frenetic. Investigators moved through the corridors with the deliberate pace of people building a case rather than stopping one. The administrative wing was sealed behind evidence tape. The trauma bay was running at reduced intensity as the most critical patients stabilized enough to be transferred to monitored care rooms, and the patients who'd been in monitored care rooms long enough were beginning the incremental return towards something approaching normal function. Dolores Faber's husband was out of the ICU by 9 a.m. Kara found out when Faber herself flagged her down in the corridor, still on IV lines, still in a hospital gown, but upright and moving under her own power with the careful deliberateness of someone who knew their limits, and told her. "I wanted you to know," Faber said, "because you told me you would tell me when you had information, and you did. So I wanted to return the favor." Kara looked at her. There was something almost formal in the way Faber said it. The precision of the exchange. Information given, information returned. A transaction conducted with integrity. "Thank you," Kara said. "They're saying you went into the basement alone." Faber said it simply, without drama. "Is that true?" "I had radio contact." "But you were alone." "Yes." Faber looked at her with the steadiness she'd shown throughout the night. "I spent 22 years as a federal procurement officer," she said. "I've worked with a lot of people who are very good at their jobs. I know the difference between someone who knows what they're doing and someone who knows what they're doing and why it matters." She paused. "You know why it matters." Kara didn't have an answer that fit the size of that statement, so she didn't offer one. Marcus Yeld was discharged at 10:15 a.m., cleared to visit his father in the cardiac recovery unit. Kara was not there when he left the bay, but Donna told her about it afterward, that he'd stopped at the nurse's station on his way out and asked where Kara was. And when Donna told him she was in meetings, he'd said, "Tell her I found out she was right. He was being treated." He'd paused for a moment, then said, "She promised she'd tell me what she found out. I just wanted her to know I found out too." Donna delivered the message with the particular efficiency of someone who had decided it mattered. Kara received it the same way. CAST was upgraded from critical to serious at 11:30 a.m. She heard it on the internal patient status update and let it sit for a moment before she moved on. Serious was not good. Serious was better than critical. Serious was the category in which people had room to improve, and she had done everything available to her to make sure he had that room. It was enough. She told herself it was enough, and mostly believed it. Verath found her in the break room at noon. She was sitting at the corner table with a cup of coffee she hadn't drunk and a sandwich she'd been eating mechanically for the last 10 minutes without tasting it. He sat down across from her without asking permission, which was fine because she had no energy left for social architecture. "Doss is in federal custody," he said. "Pruitt is in custody. The 3 individuals from Bracton Miles responsible for deploying the devices are in custody. Devin Hartwell, the principal officer, was arrested at a private airfield outside Bozeman at 8:40 this morning. He was 40 minutes from getting on a plane." She looked at her coffee. "The 4th device has been safely removed by EOD," he continued. "The device at Iron Gate sublevel is being secured by EOD as we speak. They arrived 20 minutes ago. The valve interrupt held. I know it held. I was there when it held." "I know you were." He put his hands flat on the table. "I want to talk to you about what comes next. What comes next is I finish this sandwich and go check on my patients. After that," she looked at him. "Verath, I've been awake for 26 hours. I don't have the bandwidth for what comes next right now." "I understand that." He didn't move. "But I want you to know that what you did tonight, both of the things you did tonight, the medical response and the sublevel, is going on record. Fully. I'm writing the report personally." She picked up her coffee. "Okay. The Army will see that report." "I figured." "Is that—" He paused. "Is that a problem for you?" She thought about that honestly, because it was a question that deserved an honest answer rather than a reflexive one. The Army seeing it, her file being updated, the classified incident from 11 years ago intersecting with this one in a federal document that would exist permanently. "No," she said, "it's not a problem." "Good." He started to stand. "Verath?" He stopped. "The atropine restock that Pruitt approved 6 weeks ago. Rourke is already looking at it, but I know, it's in the report. I want to make sure the patient's families understand that piece of the timeline, that the supply situation was managed, that nobody died because of it." He looked at her steadily. "Nobody died." "I know, but families are going to have questions, and some of those questions are going to be about why 79 people were poisoned and the hospital had enough medication to treat them when they wouldn't normally have had enough medication to treat them." She set down the coffee. "That's a question that deserves a real answer, not a bureaucratic one." Verath was quiet for a moment. "I'll make sure the family liaison process includes that," he said. He left. She finished the sandwich. Outside the break room window, Duskwood was doing what small Montana cities did at noon in winter, moving quietly under a white sky, the kind of day that looked like weather was coming but wasn't there yet. The hospital parking lot was full of vehicles that hadn't been there at the start of the night shift. Federal vehicles, state police cruisers, 2 news vans parked at the outer edge of the lot with their satellite arrays up. Kara looked at the news vans for a moment. Then she looked away and stood up and threw away the rest of the sandwich and went back to work. She was 3 steps from the break room door when her radio crackled. The federal channel, Rourke's voice, with an edge in it she hadn't heard even during the worst hours of the night. "Ms. Whitfield, I need you in the administrative corridor. We've found something in Doss's financial records." "Rourke, I haven't slept." "I know. I need you anyway." A pause. "The payments to Pruitt's holding account. We traced the originating account. It's not Bracton Miles." Kara stopped walking. "It's a federal contracting office," Rourke said, "and the authorization signature on the payments belongs to a name I think you're going to recognize." The break room door was 3 steps behind her. The administrative corridor was 2 hallways ahead. Kara stood between them. "Whose name?" she asked. Rourke said it, and the shape of the last 14 hours rearranged itself entirely. The name Rourke said was Oswald Frey, not the Oswald Frey who had been arrested at 8:40 that morning at the Bozeman airfield alongside Hartwell. A different Oswald Frey, or rather, the same man wearing a different face in a different context, because the name on the federal contracting authorization belonged to a deputy director of the Western Logistics Coordination Bureau, a position that had existed for 6 years, that had overseen the distribution of 11 federal infrastructure contracts totaling over $200 million, and that had been held continuously by the same man who also happened to be a silent financial partner in Bracton Miles' security group. Kara walked to the administrative corridor. Rourke was at the conference table that Doss's investigators had commandeered, surrounded by printed financial records and 2 open laptops. She didn't look up when Kara came in. She was working through a document with a highlighter in a way that suggested she'd been at it for a while and had found more than she'd been looking for. "Explain it to me," Kara said. Rourke set down the highlighter. Oswald Frey held a federal position that gave him oversight authority over the contracting process that the logistics event was designed to finalize. He also held a financial interest in the security firm contracted to run both event sites. He used his bureau position to direct federal funds through a shell account to Pruitt and Doss 14 months ago. We believe as payment for ensuring that Irongate would have specific supply vulnerabilities on the night of the attack. Kara sat down. He paid the hospital administrators to keep our medication stocks low. Not exactly. Rourke turned one of the documents toward her. The payments went to Pruitt's account. Pruitt was in a position to influence inventory decisions without triggering formal review. But 6 weeks ago, she approved your atropine restock. We think, and this is still being confirmed, she got nervous. She didn't want to be connected to mass deaths at the hospital where she worked. So she approved the restock quietly, without telling Doss, without telling Frey's people. Which is why Doss and Frey didn't account for the supply margin in their timeline, Kara said. We think so. The irony of it was almost architectural. The corrupt official whose partial conscience had made a single quiet decision that undermined the attack she'd helped plan, probably without understanding that she was doing it, probably without thinking about anything beyond her own insulation from the worst of the outcome. Pruitt hadn't approved that restock out of decency. She'd approved it out of self-preservation, and 79 people had lived longer for it. Frey is already in federal custody, Rourke said. He was arrested at his bureau office in Helena at 11:15 this morning. He'd been at his desk when the team arrived, reportedly had his coat on. She paused. Ready to leave, but hadn't left yet. Like Pruitt in the parking structure. People like that calculate until the last second and then can't move, Rourke said. They've run every scenario for so long they can't pick one. Kara looked at the financial records on the table. 14 months of payments. 6 years of Frey in a federal position with access to hundreds of millions in contract authority. The attack on the logistics event hadn't been a desperate act. It had been the move of someone who had been building toward it for a long time and believed the architecture around it was solid enough to hold. It hadn't held. But not because the architecture was bad, because a floor nurse on a night shift had recognized a symptom pattern from a decade-old field experience that she'd never told anyone about, and had made decisions that nobody in the building had authorized her to make, and had been right enough times in a row that the structure built on her death, and the death of 79 federal personnel, had nothing to collapse onto. What do you need from me? Kara asked. Your formal statement on the sublevel incident and the valve interrupt needs to be filed today, Rourke said. Prosecutor's office wants it. EOD has confirmed the interrupt worked as described and that your account of the mechanical sequence is accurate. She held Kara's gaze. Your instinct about the mechanism, the brief you read in 2015, that assessment was correct. Well, it was a 40% chance, Kara said. It worked. That's not the same thing as it being the right call. It worked. It might not have. Rourke studied her for a moment. You want me to put that in the statement? I want you to put what's true in the statement. What's true is that I made a judgment call under time pressure with incomplete information, and it produced the outcome I was trying to produce. That's the accurate version. Rourke wrote something. Most people in your position would let the record say something cleaner. Most people in my position weren't there, Kara said. The patients were there. The timer was there. The 40% was there. That's what happened. She gave her statement in the next 90 minutes and signed it at the bottom with the same handwriting she used on patient charts. Small, clear, nothing flourished. Tut. The federal prosecutor's office filed charges at 4 p.m. that afternoon. The list was long. Kara read it on the printed summary Verath brought her, standing at the central station in the trauma bay because she hadn't left the floor for anything except the interview room and the sublevel and the break room sandwich. And she wasn't going to leave it now. Devin Hartwell. 59 counts of attempted murder in the first degree. 79 patients plus the 2 federal investigators recovered from the secondary site. Conspiracy to commit a federal attack on government-affiliated personnel. Illegal acquisition and deployment of a restricted chemical agent. Obstruction of a federal contracting process. Racketeering. Oswald Frey. Conspiracy charges. Federal corruption. Abuse of contracting authority. Accessory to attempted murder across all 59 counts. Money laundering through the shell account. 6 additional counts of federal contract fraud predating the attack by 4 years. Warren Doss. Accessory to the attack, obstruction of justice, federal conspiracy, and a secondary charge of evidence tampering for the inventory record access at 3:18 a.m. The tampering charge was, in its way, the most straightforward. The metadata on the hospital's record system had his login credentials on every access, time-stamped and unambiguous, because he'd been in enough of a panic that he hadn't thought about the digital trail. Sandra Pruitt. Conspiracy, federal corruption, accessory. The prosecution was treating her partial role, the restock approval, as a mitigating factor in the accessory charge rather than a separate mitigating circumstance, which meant the charge stood but the sentencing recommendation would reflect the complexity. Her attorney would argue for leniency. The prosecutor's office, Rourke told Kara later, was not inclined to give it. The 3 Bracton Miles operatives who had physically deployed the devices, attempted murder, deployment of a chemical weapon, Federal terrorism charges that carried mandatory minimum sentences that removed most of the discretion from the eventual sentencing. Kara read to the end of the list and handed it back to Vereth. "How long until trial?" she asked. "Hartwell and Frey, the prosecutor wants to move fast. 6 months, maybe 8. The evidence is substantial and they don't want extended pretrial maneuvering." He folded the summary. "Doss and Pruitt will likely plea. Their attorneys are already signaling cooperation in exchange for sentencing consideration." "What do they have to cooperate with? What don't you already know?" "Frey's financial network. There are other accounts, other relationships. 14 months of payments to Doss and Pruitt is the piece we've unwound. There may be more." She nodded. That was for other people to pursue now. She was a witness. Her piece of it was the night, the patients, and the documents she'd signed. "The commendation request I mentioned," Vereth said, "in a slightly different register, moving from investigator to something more personal, or at least more direct. I'm submitting it this week for the field incident from 2015 and for the response last night. It'll go to the Army through standard channels." "You don't need to do that." "I'm aware I don't need to." He looked at her. "You kept 59 people alive and then went into a basement alone and made a call that saved however many more. The record should say that clearly." She looked at the trauma bay, the monitors, the recovering patients, the nursing staff moving through its late afternoon rhythms with the specific quality of exhaustion that follows sustained extraordinary effort. Donna was at the station, doing the kind of meticulous end-of-day documentation that she always did, the unglamorous infrastructure work that kept a floor running. Bautista was still there, 12 hours past the end of his normal shift, because he hadn't been willing to leave until the critical count dropped below 5. It was at 3. "Submit it," Kara said. "But I want Hart's name on it too. He ran the critical cases when I was managing the floor. If you're documenting the night accurately, document all of it." Vereth looked like he wanted to say something about that. He didn't. He wrote it down instead. The news broke at 6 p.m. Kara was in the staff locker room changing out of scrubs that had been through more than any garment should reasonably absorb when her phone started producing notifications in the particular sustained rhythm of something large moving through the media cycle. She silenced it, finished changing, and sat on the bench for 4 minutes with her back against the lockers and her eyes closed. 28 hours awake. She could feel it in the particular way that extended wakefulness eventually stopped feeling like tiredness and started feeling like a thin membrane between herself and the world. Everything slightly removed, slightly slower to process. She knew from experience that this stage was where she made her worst decisions. Not because her judgment failed, but because the mechanisms that normally flagged uncertainty before she acted on it got sluggish. She'd learned to compensate for it. She was compensating now. She thought about what the next days were going to look like. The media presence was going to expand. The story had every element that sustained coverage: government conspiracy, mass poisoning, federal arrests, a hospital. Reporters were going to want the nurse who had run the response. They always wanted a face for the story, a single human-scale version of a large and complicated event. She was going to be uncooperative about that. In the polite, consistent, complete way she was uncooperative about most things that required her to perform something she didn't actually feel. What she felt, sitting on the locker room bench at 6 p.m. after 28 hours of keeping people alive, was not heroism. It wasn't satisfaction exactly, though something in that neighborhood existed somewhere beneath the tiredness. It was closer to what she'd felt at the end of difficult days in the field. A particular blankness that wasn't emptiness so much as the space left when sustained urgency finally releases its grip. The shape of what had been there. 79 patients. No deaths. She let that sit for a moment. Didn't dress it up or frame it or attach anything to it. Just let it be the fact it was. Then she picked up her coat and went back out. Donna was still at the station when Kara came through. It was past the end of Donna's shift by 4 hours, which Kara noted with the intention of saying something about it. "Go home," she said. Donna looked up. "Petra is covering nights. She's never done a solo trauma charge rotation. She can handle it. I know she can handle it. I'm staying anyway. Kara didn't argue further. She recognized the impulse, the version of it she'd felt herself throughout the day, whenever she'd tried to step back from the floor and found she couldn't quite make herself do it. There was something about the room, after a night like this one, that made leaving feel like a small act of abandonment, even when leaving was the rational choice. At least sit down, she said. Donna pulled a stool from under the counter and sat on it, which was approximately the extent of the concession she was willing to make. Petra appeared at the station at the start of her shift with the alertness of someone who had slept and processed and arrived with intention. She got the handoff from Donna in 15 minutes. Thorough, systematic, the critical patients first, then the stable, then the logistical details that kept the floor from developing problems overnight. She asked 4 questions. They were the 4 questions that mattered. When Donna finished, Petra looked at the room for a moment. The monitors, the patients, the specific geography of a trauma bay that had been through something and was still standing, and then she looked at Kara. "I'll call if anything changes," she said. "I know you will," Kara said. She meant it without qualification. Petra had passed the threshold that night. Not the easy threshold of technical competence, which she'd cleared months ago, but the harder one of trusting her own read when the situation didn't allow time for confirmation from someone senior. She had done the thing with the resuscitation patient. She had done it without certainty. She'd been right. She would be uncertain again. She would be wrong sometimes. That was the actual shape of this work. Not the cinematic clarity of the critical moment, but the long, uneven, imperfect accumulation of daily decisions made under pressure with incomplete information and the discipline of continuing to make them honestly. Kara left the floor at 6:47 p.m. The next weeks moved the way aftermath always moved, in 2 speeds simultaneously. The immediate things resolved quickly. The critical patients stabilized and transferred to step-down care within 48 hours. The severely affected ones progressing more slowly, but progressing. Agent Cass moved from serious to stable on day 4, and on day 7 he was transferred to a facility in Helena, closer to his family. He sent a message through Rourke, brief, not flowery, the message of a federal agent expressing gratitude in the register of someone who didn't have a lot of practice with it. Kara read it once and appreciated its honesty. Marcus Yeld was discharged the same day as his father, Gerald, who left the cardiac recovery unit with a documented 40% reduction in cardiac function that was going to require ongoing management for the rest of his life. Gerald Yeld was 51 years old and had a son who was 17 and had sat in a hospital bed all night not knowing if his father was alive. And that was going to be the shape of the next years for both of them in ways Kara couldn't predict or fix. What she could do was give Gerald the name of the best cardiac rehabilitation program in Montana when he asked, which he did. Standing in the hospital corridor with Marcus beside him in the particular stance of a teenager who was trying to look like everything was fine and not quite managing it. "Will it work?" Gerald asked. "It's the best program available in the state," she said. "The outcomes depend on a lot of factors, and I'm not going to pretend otherwise, but it gives you the best chance." He absorbed that. "That's a yes with conditions." "Yes with conditions," she confirmed. He nodded. Then he offered his hand and she shook it, and he said, "Thank you for what you did in there, for all of it." "Get to your program," she said. "That's the thank you I want." They left. She watched them go. Gerald moving carefully, Marcus matching his pace without making it look deliberate, adjusting without calling attention to the adjustment, the small, unconscious acts of care that people did for each other when they were paying attention. Dolores Faber sent a letter. An actual paper letter, handwritten, 2 pages. Kara read it at her kitchen table on a Saturday morning with coffee that was getting cold. It said several things she didn't know what to do with. Things about observing people clearly, about the difference between performing a role and being someone, about what it meant to be in the worst night of your life, and look up and find a person who knew what they were doing and was doing it without waiting for permission. Faber had spent 22 years as a procurement officer, and she wrote with the precision of someone accustomed to language that meant exactly what it said, no more. The last paragraph said, "I have worked in rooms where the most competent people were routinely invisible because the structure wasn't designed to see them. You have changed what I think is possible to do about that. I don't know what you'll do with the rest of your career, but I hope you know the weight of what you carry and that it's the right weight to carry." Kara folded the letter and put it in the drawer where she kept things she didn't know what to do with, but wasn't willing to throw away. The trials were not fast. Hartwell's lasted 22 days and involved expert testimony on the chemical agent, the deployment mechanisms, the medical response, and the financial architecture that had funded the entire operation. Kara testified on day 11, 3 hours on the stand, cross-examined by a defense attorney who spent 45 minutes trying to establish that her treatment decisions had been reckless departures from accepted clinical protocol, which was the defense's parallel argument about the attack itself being an exaggerated crisis manufactured partly by the hospital's chaotic response. It was a weak argument. She knew it was weak while she was sitting through it, and she answered every question with the same precision she'd used in the interview room: clinical rationale, documented outcomes, the places where she'd been uncertain, the places where she'd been wrong and corrected, the places where the decisions had been right and she knew they were right. She didn't perform confidence she didn't have. She didn't soften uncertainty she did have. She gave the jury the accurate version. The cross-examination lasted 45 minutes. Her redirect lasted 8. Hartwell was convicted on all counts. The sentencing was held 6 weeks later in a federal courthouse in Missoula on a clear February morning with ice still on the roads. Kara was not present. She was at Irongate, working a day shift because the verdict had been delivered 2 weeks earlier and she had said everything she had to say, and there was no useful thing she could accomplish by being in a courtroom watching a judge read a sentence that was going to be measured in decades, regardless of the exact number. Work called her when it was done. 43 years, no parole. Frey received 38. His bureau connections and the scope of his contracting fraud had added charges that extended the sentence beyond what the attack alone would have generated. His 6 years as a deputy director, the authority he'd leveraged, the contracts he'd manipulated, the federal resources he'd directed through channels that served his own financial interests, were laid out in the prosecution's closing argument with the kind of accumulated specificity that made it impossible to frame as anything except systematic corruption from a position of trust. He had been trusted. He had used that trust to do harm over a sustained period of time, at scale, to people who had never known they were at risk from the apparatus that was nominally protecting their interests. Doss received 12 years under a plea arrangement that included full cooperation with the broader investigation into Frey's network. Pruitt received 9, with credit for the supply decisions that Rourke's team had documented as a mitigating factor. Not exoneration, not absolution, but the record acknowledging that she had done one thing that cut against the harm when it mattered, and that the one thing had made a difference. Kara learned Pruitt's sentence from a news notification on her phone during a break between patients. She read it standing in the supply corridor, and she thought about the restock approval, the quiet bureaucratic decision that Pruitt had made out of self-interest and that had kept 24 extra patients alive. The law had found a way to hold both things true simultaneously, the guilt and the consequence that had mitigated part of it. She didn't know what to call that. It wasn't justice in the clean version. It was justice in this version that actually existed, which accounted for the complicated texture of what people actually did and why, and arrived at something less satisfying than the clean version, but more honest. She put her phone away and went back to work. The commendation arrived in the mail in March, but a formal document from the Department of the Army, heavy paper, official seal, language that was precise and bureaucratic, and underneath the precision said clearly, "We know what you did and we are putting it in the record." It covered both the 2015 field incident and the events of November 14th. The citations were specific and accurate. The language describing the valve interrupt acknowledged, in measured federal prose, that the action had been taken under significant uncertainty and had produced a specific documented outcome. It did not call it heroism. It called it decisive action under adverse conditions with material impact on patient survival outcomes. That was the accurate version. She appreciated it for being the accurate version. Hart's name was on a separate commendation, which Verith had organized as she'd requested. He brought them both in person, drove from Missoula in a rental car on a Thursday afternoon, and found her in the break room at the end of a shift, which seemed to be his preferred location for significant conversations. He set both documents on the table. She read hers, handed it back. I don't want to keep it in the break room, she said. He picked it up. I'll send you a copy. Send me the digital file. I'll print it when I figure out where to put it. He looked at her in the way he'd looked at her in Doss's office on the morning of the investigation, with a kind of assessment that wasn't clinical so much as calibrating something. Is there anything you want? From the Army, from the Bureau, from any of the formal channels we have access to. Anything. She thought about it honestly, as she had the last time he'd asked. The policy change here, she said. The expanded nursing authority for mass casualty events. I want to make sure it holds after the attention moves on. These things get written, and then they get quietly walked back when administration changes. The interim administration has committed interim, she said. When it's not interim anymore, I want someone checking that the commitment traveled. He made a note. I'll put it in writing with the hospital board. Good. She picked up her coffee. That's what I want. He left her with the commendation in a sealed envelope, which she put in her bag and forgot about for 2 days until she found it on Sunday morning while looking for her keys. She set it on the kitchen table and looked at it while her coffee brewed. Then she opened it and read it again, alone this time, without anyone watching, without any performance of appropriate response required. She read it once, set it down, stood at her kitchen window looking at the duskwood streets on a Sunday morning in March, the snow finally receding from the edges of the pavement, the sky doing the particular thing it did at the end of a Montana winter when the light started to return to it. The document said what she had done. It didn't say what it had cost her to do it, because that wasn't the kind of thing formal documents tracked. The 19 hours of sustained effort on a depleted body, the 2 calls she'd gotten wrong, the 4 minutes in the sublevel with her hand on a lever and a number she didn't fully believe in her head, the way Marcus Yeld had looked at the ceiling all night without knowing if his father was breathing. The documents tracked outcomes. The rest of it was hers to carry in the way that people who did this kind of work carried things. Not as weight exactly, but as context. The sediment of accumulated experience that changed how you moved through the next situation, and the one after that. She put the commendation in the drawer with Faber's letter. 2 months later, in April, Iron Gate Memorial completed the first phase of its clinical restructuring under the permanent administration that had replaced the interim team. The nursing authority protocols that Kara had asked Verath to protect were incorporated into the hospital's formal operational charter, not as emergency provisions, but as standard procedure applicable anytime patient volume and acuity exceeded physician coverage capacity. The policy document cited the events of November 14th. It cited Kara Whitfield by name. It had been written in part by the interim CMO, who had sent her the handwritten note, and in part by Donna Rael, who had been asked to contribute to the drafting process, and had done so with the particular thoroughness she brought to documentation she considered important. Kara read the policy document when it was released to staff. She read it at the nurses' station, standing up between patients. It said what it needed to say, and it said it clearly, and it would exist in the hospital's operational record permanently unless someone chose to remove it, which would now require a formal process that left a trail. Donna appeared at her shoulder at the end of it. Good? Donna asked. Good, Kara said. They stood at the station for a moment in the particular quiet of 2 people who understood each other well enough not to need a ceremony for it. Then a monitor alarmed in Bay 3, and Donna was already moving before the sound finished, and Kara turned toward the supply cart to check a line that needed checking. And the floor continued the way floors continued, patient by patient, decision by decision, the long, unromantic daily practice of showing up and knowing what to do and doing it, even when no one was watching, even when no record would capture it, even when the only measure of success was the breathing of the person in front of you. That was the job. It had always been the job. She had understood that at 24 in a forward operating base in a country she'd been sent to, and she understood it now, and the understanding had never made it easier, only clearer. Some people needed the recognition to know they'd done something real. She understood that. She'd needed it once, in the way that everyone needed it once, before you found out what you were actually working toward and realized that the recognition was the smallest part of it. What she'd been working toward was this: the patient who went home, the monitor that held its line, the young nurse who trusted her own read when it mattered and was right, and who would be more right next time. and who would pass that on to the person after her. The policy that would protect the next Kara Whitfield, the next person with the right knowledge in the wrong position at the worst possible moment, and give her the authority to act without waiting for a system to catch up to what she already knew. That was the whole point. Not the commendation, not the verdict, not even the 79 patients, as real and as heavy as each one of them was. The point was what those things built toward, a world in which the next crisis had better tools waiting for it, because someone had gone through the fire first and come back with the blueprint. She hadn't planned to be that person. She'd planned to be a night shift nurse at a regional hospital in a small Montana city, doing good work in a room that mostly nobody saw. She was still that person. She was also the other thing now, the version of herself that the record acknowledged, that the policy reflected, that the drawer with the letter and the commendation quietly contained. Both were true. Both required the same thing from her tomorrow morning. She picked up the supply cart and pushed it down the hallway, and the hospital moved around her the way it always had. And she moved through it the way she always had, and the lights above her were steady and bright, and there was work to do.